Hello, you're welcome to the Dr. FAKAY show. This show will be based on four categories: health matters, business talks, life coaching, and motivational speaking. It promises to be an outstanding and interesting program that you'll enjoy from time to time. You don't want to miss it. Stay tuned. Today, we're on health matters and specifically on cervical cancer. As is generally known that this is the end of January 2023 and January is Cervical Cancer Awareness Month. According to WHO World Health Organization, cervical cancer is the fourth most common cause of cancer in women, and it was estimated in 2020 that about 604,000 new cases were found and about 342,000 deaths were recorded towards cervical cancer. In the same year, about 90% of the new cases and death worldwide occur in low and middle income countries, that is the developing countries. So, it's of importance that women all over the world should be aware of some important information about cervical cancer. What is cervical cancer? Cervix is the entrance to the uterus from the vagina. While cancer is a disease in which some of the body cells grow uncontrollably and spread to other parts of the body. So, when cancer starts in the cervix, it is called cervical cancer. What are the signs and symptoms of cervical cancer? As signs, your healthcare professional may observe 1. Cervical smear showing invasion, though it's been said sometimes that it's unreliable. Secondly, incidental finding on treatment of cervical intraepithelial neoplasia. As symptoms, the things you may observe that might be pointers to have yourself checked for cervical cancer. Number 1, postcoital and or postmenopausal bleeding. 2, watery vaginal discharge, which is sometimes foul smelling. 3, features of advanced disease, including heavy vaginal bleeding, ureteric obstruction, weight loss, bowel disturbance, vesicovaginal fistula, and pain. Vesicovaginal fistula is a situation whereby the disease has caused a hole, a channel, to be created between your bladder and your vagina. In this situation, you're going to be having urine leaking from the bladder through the vagina. What are the risk factors for cervical cancer? Number 1, persistent infection of a particular virus called high-risk human papilloma virus, that's HPV. 2 types are known for this cause: HPV type 16 and type 18, and are responsible for nearly 50% of high-grade cervical precancer. Number 2, exposure to HPV is increased by multiple sexual partners. It is worthy of note that HPV is mainly transmitted through sexual contact, and most people are infected with HPV shortly after the onset of sexual activity. More than 90% of them clear the infection eventually. Therefore, sex education tailored to age and culture is important. 3, smoking is also a risk factor. The reason why health information and warning about tobacco use is very essential. Number 4, immunocompromise. HIV, transplant patients, immunosuppressants. All this make women susceptible to high risk of cervical cancer. Women living with HIV are 6 times more likely to develop cervical cancer compared to women without HIV. Number 5, the oral contraceptive pill is somewhat associated with cervical cancer, but probably due to reduced use of barrier contraception, increasing exposure to HPV. Therefore, condom promotion and provision in sexual activity is important. Screening for cervical cancer. Worldwide screening interval for cervical cancer vary considerably. English cervical screening criteria. This screening is done in sexually active women between the age of 25 and 64. They do it 3 yearly for women between 25 and 50, then 5 yearly until the age of 64. They do it yearly in HIV positive women, and 95% of abnormalities are identified by the 3 yearly screening. In Scotland, the screening actually starts at the age of 20 years. WHO cervical cancer screening recommendations. WHO now encourages countries to use HPV tests for cervical screening, including HPV DNA and HPV mRNA tests. HPV DNA testing detects high-risk strains of HPV, which cause almost all cervical cancers. HPV mRNA detects HPV infection leading to cellular transformation. Unlike tests that rely on visual inspection with acetic acid (VIA) or cytology, commonly known as pap smear, currently the most commonly used methods globally to detect precancer lesions. HPV testing is an objective test. It has been shown to be simpler, prevents more precancers and cancers, and saves more lives. It's also most cost-effective. According to WHO, screening should start from 30 years of age in the general population of women, with regular screening with a validated HPV test every 5 to 10 years, and from 25 years of age for women living with HIV. Women living with HIV also need to be screened more frequently every 3 to 5 years. The process of healthcare provider obtaining a cervical sample is similar with both cytology and HPV testing. However, WHO suggests that self-collected samples can be used when providing HPV DNA testing, although this does not apply to HPV mRNA tests. Women need to receive appropriate support to feel confident in managing this process. Screening must be linked to treatment and management of positive screening tests. HPV positive women may be treated without diagnostic verification in limited resourced settings. A test to triage the HPV positive women, e.g. VIA, is essential for treating HIV positive women. How can we prevent cervical cancer? The cost-effective way to prevent cervical cancer is by vaccination against HPV, screening, and treatment of pre-cancer lesions. Can cervical cancer be cured? Yes, cervical cancer can be cured if diagnosed at an early stage and treated promptly. So, the diagnosis, examination, investigations, and treatment are carried out by medical specialists and qualified healthcare professionals. So, in summary, the comprehensive cervical cancer control includes 1. Primary prevention, that is, vaccination against HPV. 2. Secondary prevention, that's screening and treatment of precancerous lesions. 3. Tertiary prevention, that's the diagnosis and treatment of invasive cervical cancer. And 4. That is when you give palliative care. This is the end of today's edition. Please leave your questions and comments below. Remember to subscribe to our channel, hit the notification button, and share the video. See you in our next video. You can check for the reference for the content of this video in the column below. Thank you.